I'm Roger Baker, Executive Director of the Stratfor Center for Applied Geopolitics at RANE, a global center of excellence for geopolitical intelligence and analysis. Learn how you can put geopolitics to work for your organization at ranenetwork.com.
Welcome to the Beyond COVID podcast from RANE Network. In this podcast series, David Lawrence, the founder of RANE, speaks with Dr. Fred Southwick, an infectious disease specialist at the University of Florida's College of Medicine, and Dr. Bill Lang, an expert in public health responses to biological incidents about the infectious disease landscape.
Fred and Bill, thanks again for joining us post-Labor Day. A few topics of interest. I thought we might start with a little bit of tutorial around mosquitoes and some of the issues that are arising. Maybe start with you, Bill.
Sure. So I'll talk a little bit about why we are starting to see more mosquito-borne disease. I think when probably most of the people listening to this growing up, you thought of mosquitoes as something that just gave you something that itched. And people, for the most part, did not worry in North America about mosquito-borne disease. But what's been happening as we have had some climate change, and in fact, warming, shorter cold seasons, and longer summers, is that mosquito populations, the normal mosquito populations, don't necessarily get killed off, and then on top of that, mosquito species that were more common in Central and South America, as well as other parts of the world, but especially Central and South America, where they more commonly carried viruses and sometimes even parasitic diseases, are actually able to increase their range into the United States. So probably the biggest thing that has been happening is that the mosquitoes, even the typical mosquitoes of the Northeast that can carry viral disease, including West Nile virus and Eastern equine encephalitis, those are the two most common. They're not getting killed off in the wintertime, and then so their populations are just increased in the summer. So now we're starting to see diseases like Eastern equine encephalitis, which for most people actually doesn't cause any disease. They can be infected, but it doesn't do anything. But rarely it can cause severe encephalitis or swelling of the brain, and can cause death. And there has been this year, there was a death of Eastern equine encephalitis in New Hampshire. So consequently, the far Northeast is actually very, very concerned about this. But it's not new. It's been around. All of these viruses have been around. And we can expect that we're going to see more of them if we're unable to control mosquito populations. And the weather is not going to help us to be able to do that. So that's kind of the basis of from a mosquito standpoint, why we are starting to see more of these viral diseases borne by mosquitoes that are significant.
Yeah, Bill, the comment, these viral encephalitides due to these distinct viruses, they can attack the cerebral cortex, the actual brain. And they're different from a case of meningitis where someone just gets confused and falls asleep. With encephalitis, individuals will change their behavior. They may hear things, they may see things, they may actually start talking in bizarre ways. We've had patients that actually started putting on clothes over their other clothes is one typical behavior. So it really involves the upper part of the brain where for normal behavior. So it's very frightening when it occurs. We've seen cases in Florida since I came here. And generally what we do in Florida, and I think everyone else needs to do, is we avoid the first early dawn. That's when the mosquitoes are feeding. And then at sunset. So sunrise and sunset are the two times when the mosquitoes are feeding the most. And the more bites you get, the higher the likelihood you might get the bite from a mosquito that's carrying Eastern equine or West Nile. The West Nile was a particular problem for a while in Florida, and I think it is throughout the United States. And other things, the other complaints are severe headache. They may get dizzy. They may have problems walking, as well as these behavior changes. So beware of someone with a severe headache after mosquito bites. That could be encephalitis.
And the other thing that's of concern is that, as I mentioned briefly, that the range of these mosquitoes are changing. So some of the diseases that you normally think of as tropical diseases, like chikungunya and dengue, they are transmitted primarily by the Aedes aegypti mosquito, which the range of that used to be limited in the U.S. to the marshes of Louisiana, the swamps of Louisiana, and very far south Florida. That was about it. It now stretches up to even to the basically DC level. You can still see Aedes aegypti. There is one other mosquito species, Aedes albopictus. That has a much wider range, but it's not an effective carrier of the virus. It does carry it, but we're going to start seeing more chikungunya and even locally transmitted dengue in North America, especially southern North America. And when I say southern, I mean well up into the mid-Atlantic and correspondingly across the plain states.
Bill, one other thing I forgot to mention is preventive-wise, I strongly recommend DEET. So you want insect repellent at those times if you have to be outside. That's very important. I carried around, for instance, 2 weeks ago, we were on a canoe race, and somebody noticed there were a few mosquitoes. Everybody had DEET and immediately put it on, because in Florida we're very aware of this problem.
And there are significant public health activities that can be taken that Florida is used to. Various sprays, people being very careful about leaving standing water in their yards. Old tires, one of the favorite breeding grounds for many mosquitoes. Gutters that don't empty completely, because all it takes is, depending on the breed of the mosquito, is about 48 hours, again plus or minus, for eggs to be laid, hatched, and become actively flying mosquitoes. So clearing any standing water from your property, your neighbors doing the same, can make a big impact on the number of mosquitoes. And then, as Fred said, the use of DEET in high concentration DEET is also very important, as well as if you're an outdoor worker at all, or you're going to be spending a lot of time outdoors, is impregnating clothing with permethrin, which you never put it on body directly, but you can put permethrin on clothing, and it will effectively repel mosquitoes and ticks, the other insect vector of significant disease in North America. So think seriously about doing the permethrin. It's not permanent, as in the name, but it'll last most people a whole season.
Bill, you've spoken before about ticks, but the nature of, we'll call it the warming, shortening of cold seasons, lengthening of warmer periods, additional rainfall, that has led to increases in the tick population and incidence of tick bites causing various medical issues. Do you have any updates, you and Fred, on thinking through both what people should be looking for and what they can do on a preventative scale?
So yes, David, fortunately, the prevention for ticks and the prevention for being bitten by mosquitoes are fairly similar. The DEET and the permethrin approaches work very well. Some of the other things that you can do, which especially in warm times of the year, people don't like the idea, is wear long white or light colored colored clothing, long sleeves, long pants. Then that way you can see ticks, and mosquitoes don't typically bite through any cloth material. So by doing that, you can help prevent getting bitten by either ticks or mosquitoes. The other thing to remember is that ticks are primarily in wooded and especially brushy or grassy areas. So if you keep your yard well manicured, it's very unlikely that you're going to get ticks. And the most common place for ticks is either in woods or in the buffer areas between residential and woods. But woods don't have to be large scale. It could just be a woody area that's the size of a lot. House lot, that's going to be set up for having ticks. It's basically anywhere where you're going to have woodland rodents and or deer. Deer get the bum rap for this. Well, I shouldn't say it's a bum rap. They are an important part of it, but typically the ticks go from deer to woodland rodents to humans, not directly from the deer to the humans. So they're just a part of this whole milieu that's important for getting tick bites. So anytime you're outdoors in or near a wooded environment, in or near brushy high grass, people should be thinking about treating themselves and their kids with DEET, considering permethrin even, to prevent tick bites.
Okay, great advice. Just to circle back, because you spoke about preventative measures with mosquito bites, and obviously we have a number of clients who have children, and so this is equally important for them. But should someone get bitten and then start to exhibit, Fred, some of the symptoms you've described already, what is the best advice to people who all of a sudden find themselves not feeling well? Aches, pains, headaches, disorientation, etc.
Right. Well, first of all, one thing you should do is every time you go into a wooded area, when you come out, do a careful inspection for ticks, because the tick has to be attached roughly 24 hours to transmit Lyme disease, babesiosis, or anaplasma or Ehrlichia. Those are the four that we can get infections that are contracted by ticks primarily. So if you can catch them and remove them before they adhere for a long time, you won't become infected. One little problem though is it turns out that the nymph tick, they're very tiny, are the ones that are most infectious, and you may miss those if you're not careful. Now if you notice that you have a tick and it's been on for over 24 hours, what's recommended is a single dose of doxycycline. 200 milligrams will serve as prevention. Now, if you think you might have gotten a tick and now you're developing a febrile illness or you're getting fevers, muscle aches, then it's likely or possible that you may have one of the tick-borne illnesses. So what is recommended is you should get tested for those, and the Lyme testing is quite good. Babesiosis is a little trickier, but also, and the other two also can be tested. And then after you've gotten the test, if the symptoms are suggestive, again, the treatment of choice is doxycycline, usually 100 milligrams twice a day for a minimum of 10 to somewhere between 10 and 14 days is the recommended treatment. Now in Lyme disease, there's one very classic finding that you may get. It's a target lesion that where it'll be pale in the center and then be a real red and spread out. And that erythema chronica migrans is what it's called. That is pathognomonic for Lyme disease. If you get that, you really don't need to do testing, and they should have a prolonged treatment for a minimum of 2 weeks of doxycycline.
But the absence of the rash does not mean that you're out of the woods.
Absolutely not. That's pretty rare to see that lesion. But if you do see it, you can make the diagnosis.
And getting the advice, if after being bitten by a mosquito or mosquitoes, and you're not feeling well, what's the best advice?
The hard part is with the mosquitoes, and people are typically bitten by mosquitoes all summer long. So if you've got flus are not as common. They're not. They don't. It's not that they don't happen. They're not as common during mosquito seasons. So if you've got flu-like symptoms during mosquito season, you may want to consider if it doesn't go the way a typical flu is going, you should consider getting evaluated for one of these other insect-borne viruses. I do want to note one thing is that the other insect-borne disease that is not in the United States to a great extent yet is malaria. There have been several locally acquired cases of malaria in the southeast in the last few years. But if you go back in American history, up until the early part of the 20th century, the very early part of the 20th century, Washington, D.C. was considered to be, by the British Foreign Service, a hardship post because there was so much malaria in Washington. And it wasn't that some drug came along to cure that. It's that public health measures were applied of literally draining swamps, encouraging people to get rid of standing water in their yards and in public spaces, and treating bodies of water that could not otherwise be drained. And those measures essentially eliminated malaria in the Washington, D.C. area, and the same things were applied across the rest of the southeast United States, and essentially eliminated malaria in the southeast. So what that shows is that careful attention to mosquito populations can make a big difference.
Fred, anything you would add to that? If people begin to experience symptoms post-mosquito bites?
Yeah, well, most of as we mentioned, unfortunately, the viral encephalitis, there is no treatment. So you don't, may need supportive care, but there's no treatment. Obviously, for malaria, and there were a few cases in Florida about a year ago, and so it was around the Miami airport area. But that is always a concern, and that is very, very treatable. And if there are different strains of malaria, the one that we worry about the most is called falciparum. And the reason we worry about that is it doubles very quickly, and it can spread to many, some of the malaria forms can only infect very, very young red cells, but that is not the case when it comes to falciparum. And it can infect all, so you can get a high level of parasitemia. If all the red cells are infected, they all lyse and can cause massive, it can cause renal failure, liver failure, shock, and death. So certainly, if you start to get a hectic fever and you've had mosquito bites, you should worry about malaria.
Okay, switching the dial a little bit. Any update on COVID, influenza that our audience should be aware of?
The biggest thing is that COVID did not really explode. Last time we talked, it looked like there may be a significant uptick in COVID cases. It didn't happen. The wave of increases kind of fizzled out. That's not to say that COVID is gone. I think it's probably saying as much as anything that people aren't testing for COVID anymore. It is still out there, and the question is, did it increase in the midsummer because people were driven inside by the heat, and so that's where you had the transmission there. And now that we're in the early fall with windows open, people outside, we're not seeing it as much. Then will it come back again? I don't think it's going to come back again as a major impact. We may see increased cases and all the things. I won't go through all the things that we've talked about before as to why COVID should just be looked at as another coronavirus rather than as a significant disease in and of itself. but I think that we very well could see more. So people who are at risk should continue to consider vaccination. The vaccination rate that CDC is seeing is basically half of what they expected, and they did not expect a high vaccination rate. So that's where things stand with COVID. Fred, anything to add on that?
That was a good summary. Fortunately, it seems to be a milder disease for the most part, and if you're older and at risk, Paxlovid is very effective. So we've got, I think, one of the big benefits why we're not having a problem. There's tremendous herd immunity. In other words, probably greater than 90% of individuals have been exposed, so that even though you may not have high levels of antibody to start, your ability to remember and react is very good. So that's another reason why the cases are milder and there are fewer of them.
So moving on to flu, there has not yet been any significant increases in flu. The Southeast is a little higher than the rest of the country, but generally flu has not really kind of showed its hand yet. This is still early though. Where we typically start seeing flu season really start to pick up is in early to mid-October. There was some concern about it a couple of weeks ago that we may start to see rates picking up early, but doesn't seem to be happening yet.
Yeah, I agree. I think the best time to get the vaccine is probably about the very beginning of October or late September. So it's coming up, and we all should get it. Apparently the strains that they picked to generate for the vaccine do match what was occurred in Australia. So I think that we've got a more effective vaccine than usual that should be very helpful in preventing disease.
Okay, great guidance. I've noted with both of you that the reports that I think as recently as just a couple weeks ago were rather alarming about mpox or monkeypox. Those reports seems to have abated somewhat. Am I misreading the literature and the press?
Well, what's interesting is that the press about it just kind of went away. I think once people realized that this isn't a big thing, it's the concern went away. Is it around? Yes. Is it transmitted the way we've discussed in the past? Yes, it is. But it's not taking off, and it is not likely to take off as any kind of epidemic, pandemic.
Fred, any thoughts as well?
The good news is the rate of spread, the efficiency of spread was fairly poor, and that's very important. Unlike the coronavirus, which spreads very easily, these were not spread as easily. It was mostly the strain that's most predominant. You have to touch. It's really touch that's the primary form of spread, and that's why it did not take hold.
Okay, I just want to close with a question because you raised an important issue in the context of mpox, which is vaccine supply, and you noted about the smallpox vaccine. Any overall concerns with how we're thinking about infectious diseases and the stockpiling of vaccines?
We have. Yeah, this is something I spent a lot of time on earlier in my career. We've stockpiled for many years the smallpox vaccine, which is the vaccine that is used for mpox. We don't believe there is any smallpox in the world, but we don't know how much smallpox is in storage labs around the world. It's not in the wild, but it could be around. The only way to combat a smallpox outbreak is isolation and vaccination. So we want to be very careful about utilizing a smallpox vaccine for a situation that can be managed through behavioral means. That's the primary thing I'd say. The other vaccines, the kind of the usual vaccines that people get, people have to get them. And I just say that there's, when you look at the vaccine recommendations today, it's intimidating when you look at the number of vaccines that are recommended. But that's because they work. Vaccines really do cut down, they have significant impact on disease. And I know there are people out there who have significant concerns about the effects of disease, of vaccinations, especially on autoimmune disease. But I think that we've got, I'm stating opinion now, the amount of data that we have on the positive effects and the negative effects of vaccine have clearly shown the benefits of almost all vaccines to far outweigh the risks, and they are true risks of autoimmune diseases associated with those vaccines. So I'm a believer, but I'm also a believer in checking every vaccine that we develop to make sure that risk-benefit ratio remains in the favor of the vaccine.
Great advice. Fred, anything to add to that before we close for today?
Well, vaccines are responsible for, I would say, Bill would know a little better than I do, but probably for at least 5 or 6 extended our lifespan of the modern world by probably a decade. So these have been incredibly beneficial, and it's always frustrating when these discoveries were made in the 1800s, how effective vaccines could be. And yet we have all this anti-vaccination behavior now. It really, it's like we're going backwards rather than forward, which is very frustrating because one little shot and you're saved. And my feeling is in almost every case, you're better off being vaccinated than not being vaccinated. And so I'm very much in favor of vaccination.
And I'm going to pull one of Bill's references in history to out of the context of malaria, Bill. I was going to say the consequences of being in Washington may be as dangerous as malaria.
You're here.
Hardship pay is in order, and I'm not. By the way, Bill, I'm going to stay away from the political saying of "drain the swamp." Okay, even though it is relevant to malaria. Okay.
That's right. It works for both
right,
both
exactly.
scenarios.
So anyway, all right. Thank you both. These are important updates, and my reference to Mpox receding from the headlines. It's just I noted this because the reason we do this is because it can be misleading just to follow the headlines. You can very often miss things, or you can be overly alarmed about other issues. So you guys are always great in sort of helping us think through these things in a very deliberate, calm, and I'll call it evidence-based way. So thanks again. We'll talk to you soon.
Thank you, David.
Take care, David.
This is the RANE Insights podcast, which is part of the RANE Insights series, comprised of both virtual and real-world events offering unique practical perspectives from RANE's leading experts in risk management. To learn more, please visit us at ranenetwork.com. That's RANE network.com. Thank you for listening.